John was working in an MNC. Because of layoff, he lost his job. He was silent for several weeks. Then he started behaving as if he has got superpowers. He spent all his money for gambling. He became restless and started crying uncontrollably and couldn't sleep. Then he was admitted to hospital. After a long process of various examinations, he was diagnosed with bipolar disorder. His father is under medication for depression. This could be a predisposing factor for his present illness. Bipolar disorder involves recurrent episodes of both depression and mania. During episodes, there is a significant disturbance of patient's mood and activity levels called mood episodes. Mood episodes. Manic episode. Person has abnormally elevated, expansive or irritable mood for at least 1 week and at least 3 of the following symptoms: grandiosity or an inflated sense of self, little need for sleep, feeling pressured to speak, talking loudly and rapidly, easily distracted, a significant increase in activities or motor agitation, engaging in risky behavior like gambling or unprotected sex. Racing thoughts may cause psychosis. A person may need to be hospitalized in some cases. Hypomanic episodes. During a hypomanic episode, the symptoms of mania only need to last 4 days in a row. The symptoms do not impair everyday functioning like they do in a manic episode, do not cause psychosis, and they are not severe enough to necessitate hospitalization. A major depressive episode must last at least 2 weeks and is characterized by either a severe sadness or feeling of hopelessness, feeling excessively guilty or worthless, sleeping problems like sleeping too much or too little, feeling agitated or alternatively feeling slowing down, eating more or less with significant weight changes, fatigue and loss of energy, difficulty concentrating, and thinking of death or suicide. So these are the 3 mood episodes. The types of bipolar disorder. Bipolar type 1 disorder involves periods of severe mood episodes from mania to depression. Bipolar type 2 disorder is a milder form of mood elevation involving milder episodes of hypomania that alternate with periods of severe depression. Cyclothymic disorder describes brief periods of hypomanic symptoms alternating with brief periods of depressive symptoms that are not as extensive or as long-lasting as seen in full hypomanic episodes or full depressive episodes. Other types. The symptoms may arise from drug or alcohol use or medical conditions. Person may experience 4 or more episodes of mania or depression in 1 year. Unspecified bipolar and related disorder. Similar to other types, but used when there is not enough information to make a specific diagnosis. The person may experience symptoms of mania and depression at the same time. Symptoms of mania. Anger or irritability, difficulty sleeping and less need for sleep, high energy levels and periods of overactivity, high self-esteem, inability to make decisions, intense enthusiasm and excitement, loss of concentration, racing thoughts, pleasure-seeking behaviors such as increased sexual activity or alcohol or drug use, reckless behavior such as risky sexual activity, and restlessness. Symptoms are severe enough to interrupt the daily activities of the patient. An extremely high or low mood can sometimes involve hallucinations or delusions, known as psychosis. During a manic period, the person may have delusions of grandeur. For example, they may believe that they are a very important person or having special powers. Symptoms of depression: feeling sad, hopeless or irritable most of the time, lacking energy, difficulty concentrating and remembering things, loss of interest in everyday activities, feelings of emptiness or worthlessness, feelings of guilt and despair, feeling pessimistic about everything, self-doubt, being delusional, having hallucinations and disturbed or illogical thinking, lack of appetite, difficulty sleeping, waking up early, and suicidal thoughts. Person with depressive psychosis might believe they have committed a crime or financially they are ruined. The person may also see, hear, or smell things that are not there. The causes. Experts believe bipolar disorder usually develops from a combination of the following factors. Genetic. According to the recent edition of DSM-5, if you have an adult relative with either bipolar type 1 or bipolar type 2 disorder, then you have an average of 10 times the chance of developing the condition yourself. Likelihood of developing bipolar disorder include family history of depression, family history of schizophrenia, and some research points to some genetic overlap between these two conditions. Then the number of family members with bipolar disorder or other mood disorder and your relation to those family members. Brain chemistry and biology. Several research links three main neurotransmitters to bipolar disorder: serotonin, dopamine, and norepinephrine. Imbalances of these brain chemicals may prompt manic, depressive, or hypomanic mood episodes. Environmental factors. Some scientists believe that environmental and lifestyle factors play a role in bipolar disorder. These factors include extreme stress, physical or sexual abuse, substance abuse, death of a family member or loved one, physical illness, ongoing concerns that affect your daily life, such as money or work problems. Comorbidity, that is, co-occurring conditions. Some conditions seen along with bipolar disorder can worsen bipolar disorder symptoms or make treatment less successful. In general, about a half to two-thirds or even more of the patients with bipolar disorder have a comorbid psychiatric condition. And the examples include anxiety disorder, eating disorder, attention deficit hyperactivity disorder, alcohol or drug problems, physical health problems. Diagnosis. Physical exam. A doctor may perform a physical exam and order lab tests, including a thyroid function test and urine analysis. These tests can help determine if other conditions or factors could be causing the symptoms. Brain imaging studies might be ordered if you have a history of head trauma. A major part of the diagnosis of bipolar disorder involves ruling out other potential causes of mood and behavior fluctuations. Psychological assessment to assess the symptoms and mental state of the patient. Mood charting to keep a daily record of the patient's moods, sleep patterns, or other factors that could help with diagnosis and finding the right treatment. Differential diagnosis. Determining the subtypes and differential diagnosis is done to rule out other medical or psychiatric conditions that cause symptoms that resemble the symptoms of bipolar disorder. Management. Psychotherapy, interpersonal and social rhythm therapy, cognitive behavioral therapy, psychoeducation, and family-focused therapy are used. Studies shows positive result in regard to decreased relapse rates, improved quality of life, increased functioning, or more favorable symptom improvement through this psychotherapy. Electroconvulsive therapy or ECT. It is passing mild electrical current to the brain to alter its chemistry and functioning, usually given in severe cases or when rapid definitive medical psychiatric treatment is needed, or when the risk of ECT is less than that of other treatments. Substance abuse treatment. If the patient have problem with alcohol or drugs, he also needs substance abuse treatment. Otherwise, it can be very difficult to manage bipolar disorder. Medications. It include mood stabilizer to control manic or hypomanic episodes, antipsychotic drugs if the symptoms of depression or mania persist in spite of treatment with other medications. Then antidepressants to help manage the depression. Anti-anxiety medications help with anxiety and improve the sleep but are usually used on a short-term basis. So hope you like this video on bipolar spectrum disorder. Please subscribe for videos on related topics. Thank you and keep smiling.